and then I will show a small presentation, and then we will have a Q&A. The whole idea is just to know each other well. There is no pressure. We don't have to be perfect. Let our hand shake. Let us wobble. Let us take more time. There is no hurry. The idea is to be ourselves. You did not choose Parkinson. Parkinson chose you. If you are okay with my blinking of my eyes, I am okay with you shaking your hand or taking time to speak. So it's absolutely fine. Just be yourself. We are here for one another. Yeah. Thank you for logging in again and coming again. I would like to now invite Uma Devanathan and can request her to share a story.
Hello. For the past 17 years, I am having this disease. Just in 2004, when I came to US for my daughter's delivery, my left hand, my left elbow was started paining. First, I didn't realize that. Then I went back to India. Then I had a severe pain in the left elbow. It was very difficult to stretch my left hand. Then we went to many neurologists and orthopedic surgeons. Nobody could able to diagnose it. So after that, I came to Dr. Prashant. He gave me
sorry for the interruption, and I'm just taking over a short while. And she was put on the specification medication for Parkinson's disease. Of the diagnosis was made in 2014, and she was on Sindopa and the combination of medications, and she did respond very well for nearly about 10 years. Actually, physically, she was very active, and she could drive the car very well. After over a period of 10 years, what has happened is the disease has become a little refractory. The response to the specific medications have become very poor. So that time in sometime in 2019, we consulted Dr. Prashant LK in Vikram Hospital, and they initially for about a week and 10 days, a modification of the medication was tried, and after 10 days she was reviewed, and the modification of medication did not work at all. And ultimately, it was decided to admit her and give a trial of the subcutaneous apomorphine infusion. From 18th November 2019 onwards till today, she's on apomorphine infusion, 3 milligrams per hour, spread over a period of about 12 hours. And as long as she's on apomorphine pump and she's physically active, no one can make out that she has got Parkinson's disease. Rest of the time, she will be put on Sindopa and the combination of the medications, and we can still manage without apomorphine.
At present, I am not in.
Currently, now, today morning, since morning, she is not on apomorphine, and she is able to communicate, and physically she is active. And today morning, she had, today happens to be her birthday. She also had good cooking and all that done just now, and we are in the United States. Two important message that Uma asked me to convey to all those who are online now. The important message what Uma wanted me to convey is one: as long as you are psychologically stable, you can just come over all the problems of Parkinson's disease. So the psychological instability aggravates the problem. One. Number two, a physical activity is very, very important. That's what she has been telling, and physically it is very stable. As you had already told, she does Surya Namaskaram periodically, and also got herself engaged in yoga. And she's the one who desires to have more number of people to interact, and she's a good host at home, and people come home to see her, and she interacts very well. So it, as long as she's mentally very, very clear, and physically it makes her very comfortable. The medication.
Thank you, Mr. Devnathan. Thank you so much. And wishing you a happy birthday again. Good to see that you are active, you are a good host, and you like to cook. Lovely, lovely. Can we please unmute and give them a round of applause? Thank you for being here. Thanks a lot. So, moving on, before I call Dr. Prashant and we can have a Q&A, I'm just going to show you a small presentation which I have designed. The idea is to spread awareness. The idea is to bring a support group like this. The whole idea of Dr. Prashant is to have a support group like this where we can openly talk and break the stigma. Okay, so I'm just going to share a small presentation. And yeah, can you see my slide? Yeah, can you see this, Dr. Stephen? Can you see him?
Yes.
Okay. So look at him, at 21, he was detected with neuromotor disorder, and that someone like with that disorder can live only for 14 months. At 21, he was diagnosed with that, and he went ahead and lived till 76 with his will. And not only that, he's a great scientist. He has discovered something like black hole. So what I'm trying to say is that you can do a lot with what you have right now. So there is nothing to worry. You just need to move on and a desire. Now, what I want is there in front of you is a queen penguin, and others are the chicks. Okay. The idea is that if you have Parkinson and you are with other people, you constantly keep comparing yourself. I am not able to be so active. My speech is slurry. My hand is shaking. I can't talk continuously. So you keep comparing yourself when you are with the general crowd. A support group is where you can be with people like you. And this is what the support group is all about. This is what is the effort of Dr. Prashant, where we all can come together and you can live happily, connect and bond with people having Parkinson. So you don't have to compare yourself with the outside world. You can be with people, live together, enjoy life, and live it to the fullest with your group, with people with Parkinson as a support group. That is the whole idea. Now, the idea is to destigmatize. There is a lot of stigma, we quickly say that I have fever, I have diabetes, I have blood pressure, but we don't openly say that I have Parkinson because we are ashamed and embarrassed. But we did not choose Parkinson. Parkinson chose us, right? So the idea is that to understand, like so many people talking about that, Parkinson may shake your body, but don't allow it to shake your confidence. It's completely fine. You did
May I
not
add
choose
something
Parkinson.
here? May I add
Parkinson
something
chose you.
here? May I add something here?
Can we complete it and then we
Okay,
can talk?
okay,
Is that
okay.
okay?
As you say, as you say. Okay, thank you.
Thank you. So second is, as somebody mentioned, I think it was Mr. Rajiv, acceptance, we need to accept. Yes, I have Parkinson, maybe you have achieved so many things in life and very fast. You get a bungalow, you got a car, you got a house. Now, if your thumb movement is slow, then why? What's the problem? When you have lived your life on a fast lane, if your movements are slow today, so what? You did not choose Parkinson. Parkinson chose you. Other is to respect. You've done so many things for your kid. You've cleaned their potty, their urine, their
Your
tears.
microphone is unmuted now. Muted आ रहा था पहले.
Sorry,
Your microphone is unmuted.
my microphone is unmuted. 1 second. You can't hear me? Can you hear me?
I can hear you. I can hear you very clearly.
Okay, great. Thank you for that. Okay. So, yeah, just 1 second. Yeah. So if today there is a saliva dropping from your mouth, so what? And if your caregiver or children are wiping, you have wiped so many susus and potties, okay, and vomits. So what? It's completely fine. You are not doing it purposely. It's completely fine. Okay. Next is to comfort. If you openly talk because of Parkinson, I'm not able to do this, I'm not able to hold my glass for a longer time, my hand is shaking, I'm not able to bend, I'm not able to talk, then if you talk about your limitations, other will also openly talk about how other will talk about their limitations, So when you talk about your challenges, you encourage and inspire other to talk about openly about their challenges. So that's completely fine. You did not choose Parkinson. Parkinson chose you. Okay. Next slide. And this is the last slide. So Parkinson may affect out your hand, your feet, your back, but it should not affect your spirit, your passion, your enthusiasm to live. It may take control of your face, but don't allow it to take control of your smile. That is what living the life to the fullest, whatever is it. And we have examples of people, like Uma Devanathan doing 108 Surya Samaskar. Wow, that is what we are looking at. That living your life to the fullest. Thank you for listening to me. Yeah, now I would like to bring in Dr. Prashant. Dr. Prashant, are you there? Yes, Dr. Prashant.
Hi, Umang. I'm here. I'm just listening to all of you, what is happening down there. Very good. And how do you want me to get involved here?
Sure, definitely. Thank you for joining in right now. So to begin with, does anybody have any question? Because you could ask directly to Dr. Prashant. This is a lovely time. You can ask. You don't have to get an appointment. So don't miss this opportunity. If you have any question, yeah, Mr. Niranjan, go ahead.
Yeah, I forgot to mention that I'm a patient of Dr. Prashant myself, and he has
Okay.
helped me a lot. My question is, what you said just now in your presentation is very clear, but in actual life, I'm constantly fighting with positivity and negativity.
Okay.
Constantly, one has to fight and ultimately say, oh, it's for our good to be positive, and that's the only way to live. But there's a fight going on. Sometimes the pain, discomfort becomes so much that you forget about the positivity. So how to deal with it?
So that is life, right? The
Yeah.
sun goes down and it comes up. It's life. That's what life is all about. Some days are bad, some days are good. See, Mr. Niranjan, the problem is when we expect that days are going to be good, that's where the pain is. But if we realize some days are going to be bad, some days are going to be good, then it's fine. We are prepared for that. So yes, there is a challenge to be positive. The idea also is to meet other people, to interact, and accept that there is going to be a challenge. That's fine. Yeah,
Yeah,
Mr. Prashant, do you want to add to this, Dr. Prashant?
No, I think that's fair enough. Life is all full of ups and downs. There is a positivity and negativity, however you want to see it. And we need to, whole life concept runs on that we can do better. We can have a better quality of life. And we try to work on that. And when it comes to Parkinson's disease, the same thing holds good. Because initially we come with a negative thought process. Whole of our effort goes in making you people to understand that Parkinson's disease is nothing to lose. It's not a big stigma of your life. It is something which is treatable, which helps you to improve your quality of life, which helps you to lead your near normal quality of life. And that belief you people need to get. Once we get that belief, once you see other people who are doing well, you will be start doing well enough. And how you look into the cup, that's what makes a difference. Whether looking into half empty or half full, that's what is the life is all about. And that's how we should go forward.
Absolutely. Thank you for Dr.
I
Prashant
fully
for sharing
agree.
this.
Can I take
Can
one?
I add to that?
Yeah. Mr. Niranjan, I will come back to you. Let us give chance to other people. So then I'll
Okay.
come back to you. Is that okay?
Oh, wonderful. Thank you.
Thank you. Yeah. Is somebody asking a question in the chat box, Dr. Prashant? Is it okay to mix allopathy and homeopathy together in the treatment course?
Yeah, I'll answer that question. Before that, Rajiv wanted to tell something. You want to add a point, Rajiv, there?
Yeah, to Mr. Niranjan's point, that it's a roller coaster. Sometimes you feel positive, sometimes you feel negative. I think it's expected. I mean, one can not be positive 24 hours a day. So one practical way I deal with it is I give myself, I do get into self-pity sometimes, but I give myself only 10 minutes of self-pity every day. If it is more than that, I tell, okay, rest for tomorrow. Today's quota is over. That helps me. It works for me, I think.
Lovely, lovely. And
That's
there is a
true, I
famous
guess.
song, आज मैं ऊपर, आज मैं नीचे, zamana hai peeche. So it's going to be up and down in life. It's fine. The problem is we expect that every day is going to be good. When it
You're
doesn't
right.
meet the expectations, we pain and suffering is there. If we accept कि आज कल है, कल अच्छा है, आज बुरा है, it's okay. Yeah. Next. Yeah. Can you answer that question, Dr. Prashant, about allopathy and homeopathy?
So is it fine to have Ayurvedic and allopathic treatment together?
Yeah.
I don't see a
Yeah,
reason
no,
with that. I don't see a completely a reason with that, mainly because look, at the end of the day, what we are trying to do is you're having a dopamine loss is happening, and we are trying to give dopamine from externally to supplement that. Whether you take in a X format or Y format, that is doesn't matter as long as it gives you benefit. But most important thing is to acknowledge both the things and tell to both set of doctors what you are doing. Many times what happens, people feel that I'm just taking half of this or I'm just taking half of that and feeling that that alone has made a difference. It's 1+1 what is happening down there, with which what you get cumulative effect. I have some patients who take, I think someone is here only in the group, who takes a Sindopa tablet and Kapikachu powder along with that. I have a patient who takes Sindopa one dosage and Kapikachu in another dosage. So they do it in different formulations and it works for them. As long as it works, you are happy with that. I don't have issues. But whenever you meet doctor, make sure you tell all those things, what you are taking. It helps for them to understand what is going on and advise if anything is abnormal also down there. I hope that answers that question.
Thank you.
And,
Thank you for that clarification.
May I ask one question to Dr. Prashant, please? Yes. This is my wife, Uma Devanathan, has asked me to ask this question. A very relevant question. And there is an emerging therapy coming up and becoming very popular over down south, to my knowledge, wherein they pass ultrasound beam, a non-invasive method under the guidance of MRI, and try to ablate a certain part of the tissue which is supposed to give some sort of treatment benefits with regard to tremor, etc. I may ask Dr. Prashant to highlight on this, and what is the role and what is the advantage, what is the disadvantage, to whom you will definitely refer. Is there any place in the treatment of Parkinson's disease? Thank you.
Yeah, thank you, Mr. Devanathan. Look, what Dr. Devanathan specifically is asking is about a therapy called as MR-guided ultrasound-based lesioning in the brain. So there's a terminology called as lesioning. Lesioning is burning out or cutting a part of the brain, what we do it. And lesioning is a well-established surgery for Parkinson's disease for more than 100 years. Okay, so in 90s, 20s, 30s, 40s, initially when there was no treatment was available for Parkinson's disease, mostly surgeons used to manage it. They used to go burn or cut different parts of the brain, and people used to get some relief for the symptoms. The problem with lesioning surgeries was that you get benefit, it's good for you. You get side effects, it's there with you. Nothing could have been done there. So when the medication started to come in 1950s and 60s onwards, these lesioning surgeries always went to the backstage because they had their own set of limitations. Then in 1980s or 1990s, DBS started to come in. The advantage of DBS was it was not lesioning surgery. Here we put an electrode and you give different thresholds of current. So this could have been adjusted. Means there is no specific. You have a benefit, we can adjust it. You have a side effect, we can adjust it. So what happened with time was DBS became the forefront of the surgical therapies to go on. But not all patients are right candidates for surgery for certain reasons. For example, people who are very elderly people, people who had dementias, people who had severe balance problems, they were still not a good candidates for surgery. And we never used to suggest DBS surgeries for them. But lesioning surgeries was suggested in those subset of patients to help to see what can be done. But surgery being a surgery was a risk associated with that. So this is where MR guided ultrasound lesioning surgery started to come into a picture. From 2010 onwards, it has slowly coming into the picture. Where what we do is it's a non-invasive surgery. Means it's not basically cutting open your brain and putting an electrode or something. We use like ultrasound machine in the MRI and we use like XYZ coordinates and we burn certain part of the brain. And when we do that, we get a similar benefit or similar type of benefit the way you used to get with Parkinson, with lesioning surgeries previously. So you still get a benefit, but however, not every candidate is for lesioning surgeries because this is slightly a compromise what you're doing for the clinical benefit what you're going to get. DBS is still far superior if you're looking for surgical therapies. If you are a right candidate, DBS would be a far superior surgery as compared to MR-guided ultrasound lesioning. Currently, MR-guided ultrasound lesioning is suggested for very elderly people who are not very good candidate for surgeries or who cannot tolerate anesthesia or only a certain symptom has to be benefited. We are not looking into the whole goal of making everything better. One or two symptoms we are trying to address. Those type of people can be suggested for MR-guided lesioning surgeries. So that is how it works out. I hope it covers up your question in detail, Dr. Devanathan. If anything else, let me know.
Thank you. Thank you for explaining in detail. Thank you so much, Dr. Prashant.
I just wanted to.
Yeah, MG, go ahead.
Something to Dr. Prashant.
Yes.
Yeah, go ahead.
Doctor, as you mentioned regarding this mixing of allopathy and Ayurvedic treatment, I've been doing that. I've been doing that for quite a long time. But what I feel here, what happens when you take a normal medicine, Syntopa or whatever we get here, what happens is it goes into regulated quantity. Probably the dopamine secreted in the brain, it comes in a controlled form. And when we take Ayurvedic medicine, it's one scoop or there's no measurement actually. So you just take by with your judgment. So it gives sudden boost out, it gives a lot of energy and a lot of dyskinesia, a lot of shaking movement. So is it good to have this kind of ups and downs, like one controlled and one not controlled?
Look, I usually don't suggest to do that type of changes. Okay, anything what people are doing should be taking in a measured formulations, because if you're taking an extra effect, you are what we call it as dopamine dysregulation. Means you're taking unnecessarily more tablets, or unnecessarily it can be either a tablet formulation or powder formulation. That is not good in general overall management of Parkinson's disease.
Okay.
I am talking when people tell about mixing is they're taking a fixed dosage and they know what is the benefit is there and they're maintaining that. It may be half scoop, one scoop. We can't compare, let us say a levodopa 100 milligram is not same as one scoop of Kapikachu or Zandopa powder. So there is differences in those. So some people feel certain benefit is there extra with this tablet or versus that powder, mainly because the dose differences what they can. That's all.
Okay. Thank you, doctor.
Thank you, Dr.
I have a question.
Yeah, go ahead, Mr. Satish. Go ahead.
I am taking Sildopa 275 four times a day. Then Sildopa CR 250 mg. Then Primarol, Pepexep, Amaltrex, Zanafec. Is it useful? Are they useful by medicine?
No, all those medications names what you told, those are all given for treatment of Parkinson's disease. And your treating doctor would have decided, right, based upon how it is going on, what is required, what is not required. So they'll be in a better position. I can only tell that, yes, those are all the medications which are given for a management of Parkinson's disease.
Thank you.
Hello.
Thank you, Dr. Prashant.
Just,
May I ask
just
him?
One sec,
Good
one sec.
evening,
We'll go
doctor.
one by one. One sec. Let Mr.
Good evening,
Anil
doctor.
and then somebody else. Yeah, Mr. Anil. If you have a question, please raise your hand. I will call you. Yeah, Mr. Anil.
Yeah. See, I'm Dr. Anil Kakkar. I'm a ENT specialist. 50-year experience in the field of medicine. What I want to ask him about dystonia, I got a dystonia of the left foot. All the toes, see, when I'm sitting there, it is not there. The moment I start activity or something, start walking barefooted, the toes, they go into the stage of dystonia. And it is more like a hematoid deformity of the first toe. So I'm doing regular exercises. I had a couple of times Botox also injection. Anything you can add to it?
So what happens is dystonia in Parkinson's disease, when people develop it, usually we see dystonia in young onset Parkinson's disease. Means that is due to some type of a genetic mutations, and that is what is commonly known. They have more of leg involvement, foot dystonia will be there. Even dyskinesias, what you're developing is a dyskinesia, and dystonic form of dyskinesias occur. The other common movement is this dancing movement. That is what we call as coriform movement. Coriform movement does not cause much problem, but dystonic movements cause discomfort, pain is there, and it is one of the difficult symptoms to manage. It's not so easy like you give a medication, it works out as such. Yes, the way you told, if nothing helps out, they give local botulinum toxin injections. That
So
helps.
I had botulinum, that has not worked.
That's what I'm telling you. So botulinum toxins they try out. If that does not work out, DBS they try out. They try out different combinations of medications. So for each person, it has to be tailored. The medications remains the same, but the dosage, timing, or even the correct modifications has to be tailored to see how best we can help you out. It's not that you do X and you directly get a benefit down there. It's a lot of trial and error does happen with that. You are treating
So
doctor.
I have this problem. Sorry to Bhajan. I have this problem for over 10 years, and somehow I've got a, see what I do, I got a specific done the modification of my shoes also. See, because of dystonia and all, my arch has gone. So it has become flat foot. And only in one foot, there is these toes remain, toes comes into the curved position. So what I've done, I put I have myself designed and put some extra patch in the shoe so that toes get elevated, but nothing has worked.
I think speak to your treating doctor. They have to try it out. As you have done everything, because 10 years is a great time what you would have tried on all the things. I definitely sure that your doctor would have told that somewhere they would have told that this is the best where we need to compromise on the symptom. That's what we need to understand down there.
Thank you, Dr. Prashant. Yeah, Rekha, ma'am, go ahead. You're on mute, ma'am.
Yeah, good evening, Dr. Prashant. I wanted to know, are there any indicators for developing Parkinson's later on in life? Can we get some symptoms or indicators in the prior to contacting Parkinson's?
Okay, I was just recently writing an article for something. The biggest indicator is aging. As age keeps on increasing, more likely you are going to develop Parkinson's disease. First and the most commonest indicator for development of Parkinson's disease. Higher the age, more likely that any person will have Parkinson's disease. Yes, there are various other prodromal symptoms, what we call it as biomarkers are there, what we call it as, could contribute as indicators for Parkinson's disease. Currently, we don't encourage patients to run behind them because the current therapies are not directed towards them. Current therapies are directed to once people develop certain set of symptoms, like symptomatic therapy. Like you are probably, if you may going to get a fever, it doesn't mean that you start taking antibiotic before the fever comes, right? That is how it is. So at this point of time, yes, there are certain set of symptoms are there, but most of them are utilized at research basis to understand how things are changing, what is happening to the patients, but not at a therapeutic level or counseling the patient about to expect. Is that clear?
Thank you, Dr. Prashant. Yeah, MS iPad, please unmute.
They have to unmute. I
You
think
are
they're-
on mute. You are on mute. Can you please unmute? Yeah, go ahead.
Whether syncope affects the blood pressure of the patient, because in the morning hours she is not alert at all. She finds a lot of difficulty. Whereas in the afternoon, by evening, her alertness improves and she is able to do things herself, at least small handiwork and things like that. So then the blood pressure also remains normal. So morning blood pressure is usually at the very low side.
Look, syncope does has effect on blood pressure, and there may be usually syncope increases the blood pressure, unlike dropping the blood pressure. Okay, so that's what you need to cut. However, people with Parkinson's disease, with time, they develop what we call it as dysautonomia. Because of that, blood pressure fluctuates. Their sleeping blood pressure is different, static blood pressure is different. So in her case, what might be happening is whole night she is sleeping, so blood pressure is different. As soon as she gets up in the morning, the blood pressure will take more time to get adjusted. And during that phase, she'll be dull, drowsy, headache, could be there as such. If you speak to your treating doctor, they'll tell you what precautions and modifications are required to reduce those symptoms and this is treatable symptom. It's not like something not treatable. This is treatable symptom and manageable symptom.
Okay. Thank you so much, Doctor.
Thank you. Thank you. Yeah. One second. Let's give an opportunity to somebody who hasn't spoken, because we have only 6 minutes left. Anybody who wants to ask a question first time, I would like to give them an opportunity. Does anybody have a question? Who wants to ask for the first time over here? Okay. I have a question, Dr. Prashant. What is the way to prevent Parkinson? Is there any way where you can prevent or delay Parkinson?
Good exercises, good social life, talking to people, keeping social activities more important, keeping in group of people, keep yourself more active. It may be physical, mental, social, all these aspects. When you try to work on all these things, this helps you to make better, and possibility of occurrence of Parkinson's disease is postponed. Any person who is aloof, not doing anything, more likely he'll get quickly affected with Parkinson's disease if he's having a high risk for development of Parkinson's disease.
Okay. Thank you. Thank you so much. Yeah, Mr. Niranjan, go ahead. Please unmute and ask, Mr. Niranjan.
May I ask a question in the meantime?
Yeah, Mr. Rajiv, go ahead. Then I'll go to Mr. Niranjan. Yeah, Mr. Rajiv, go ahead.
Mr. Dr. Prashant,
Yes.
do you see any hope of seeing a cure for Parkinson's in our lifetime?
Can happen at this point of time, for at least for your ears, whoever is hearing, because I am involved in various research decision making across globally. What we are seeing is lot of now we are going from symptom based therapies, we are looking into person based, with gene based therapies. We are having now medications, trials are going for certain genetic mutations like LARC2 mutations, GBA mutations. We are also going into some inflammatory based reactions like C-able products, which are already in trial phases. They look very good when we have tried on, let us say, animal models, where they have shown good improvement for people with reduction of whatever the goals what we had. We need to see how that will happen. If any one of them clicks, this is the eureka moments. Many times in science, what happens is what we see is different, what we get at the end of the day is different. If we get a eureka moment, definitely, I'm expecting at least in next a decade or two, there will be dramatic change in the approach for the management of Parkinson's. That is going to happen. In which direction it is going to happen, that time can tell, and whether we'll have a cure or elixir or amruta for life, that only time can tell us. Let us keep our fingers crossed.
Thank you. Thank you, Prashant.
One last question, Dr. Prashant. And this question, I think, bothers many of us in the group also. And we are worried about our children, doctor. I mean, do they have much higher chance of getting Parkinson's, or what can we do to,
Don't worry about them. Look, first of all, there is no clear-cut studies unless until only certain group of genetic forms of Parkinson's disease. You should remember that there are 90% of the patients with Parkinson's disease, we don't know why they have developed. So we can't even predict also whether their children will get it or not. Only this 5 to 10% of the people, that is where we look into genetic forms. So currently, there is nothing to worry about. And Parkinson's disease is an aging-related disorder. People will develop in 60s and 70s. So when we look into that aspect, people with aging, they should develop some or other aging-related disorders they will develop. And if they develop Parkinson's disease, this is something treatable, which is not life-threatening. That is how we should look at more positively as such and lead better quality of life than to keep on worrying what will happen with that.
Yeah. So lovely. Dr. Prashant said it's an aging, like our hair will turn gray and the skin will wrinkle. Same way Parkinson may happen. It's an aging disease. So thank you. Mr. Niranjan.
Umang, I want to ask one question. I'm daughter of Mr. Raman. Me and my mother are the caregivers. Are you able to hear me, Umang?
Yes.
Actually, Dr. Prashant, do you want to continue after this because it's going to end in another minute?
I think we'll take one question and after that, Umang, you can have the closing statements. We'll finish with this.
We only have 1 minute over now, 1 minute 40 seconds.
My father underwent a DBS in 2017. He was diagnosed in 2009, so it's almost 14 years. So tremors have predominantly been controlled by DBS, but of late he has developed a lot of balance-related issues. Like if he's closing the water bottle cap, he's moving backwards. If he's drinking something, standing and drinking something, he can get choking. A lot of multitasking problems and predominantly balance-related. What would be the suggestion?
Yeah. So what happens, as I told initially also, these are non-levodopa responsive symptoms. In Parkinson's disease, not only dopamine, other chemicals also get affected. As time goes by, we don't have management. We go with the palliative care for that. I'll discuss with you when we meet in detail. Okay. Thank you, Umang. I think you can take for the closing.
Okay. Yeah. Okay. Thank you so much for your.
Yeah. So coming to an end of today's session, I would like to applaud all of you for being so supportive, logging and times. Please have a round of applause for yourself. Thank you for coming over here as a community. And we are going to end in 1 minute. I want to ask you one question. If this happens offline, physically, would you come to Bangalore where we all can meet together? Will you come? Can I have a show of hands? Great. So maybe in a month or two, we all will meet in Bangalore. We'll